Yeah. Hi, good evening. How are you doing? Welcome to another session of Ask the Doctors. The program holds every Sunday by 8 p.m. Nigerian time. You're welcome. My name is Dr. Frederick Unwibohai, and I'm the host of the program. How are you? Happy Sunday to you. Now, on today's program, we'll be taking your questions. We'll have a question and answer session tonight. If you have any questions for me, you can drop your questions in the comment section and I will try my best to respond to you. My co host is Dr. Israel, and he'll be joining us very soon. I'm live on Facebook, I'm also live on YouTube, I'm even live on TikTok. So let's see if people on TikTok can also benefit from this session tonight. But tell me, where are you watching me from? If you can hear me, tell me. We have who here? Faith. Faith is watching us from Facebook. Hey, how far now? How you day? Good evening. Happy Sunday to you. So, if you have any questions for me tonight, you can drop your questions. But please remember, we will not prescribe any medicine for you here. We will not make any diagnosis for you here. If you know you have any medical problem, any medical challenge, book a session with your doctor. So don't come here and start asking, what medicine will I drink? Don't do that. Are we together, right? So if you have any questions for me and you're watching me on Facebook or you're watching me on YouTube, oh yeah, let's go. Let me see if I can respond to you. If you dey hear me, let me know. Let me know. Oh baby, you dey hear me, Abi? I'm watching from TikTok. Okay, TikTok people they here. Let's leave them. Let's leave TikTok people. Let's see. User Confi, I see you. Who be this? Jenny waiting. Jenny Cole, I see you. Okay. So, oh yeah, I'll ask your question now. Let me see whether somebody don't ask me question. Let me see. Let me check. I'm fine. Okay. Faith, I'm fine. TG. TG, how you day? Good evening. Unwali Sunday. Good evening, Mr. Doctor. Mr. Sunday. I greet you specially. I dey hear you. Oh yeah, now let's go. Oh yeah, ask me now oh. Because I noticed that people no go ask questions. Let's say we are talking about hypertension. Somebody will now come, doctor, my penis is like this. We'll be talking about maybe fibroid. Somebody will come, doctor, I cannot sleep. Today, ask your questions. Ask oh, not that next week when we start teaching something else, you start asking us, what can I take? What can I drink? You understand? Yeah, so Dr. Israel is here, and I'm going to bring up Dr. Israel now on the platform. Okay, let me bring up Dr. Israel. Dr. Israel, good evening. How you day?
Good evening. I'm very fine. Happy new month. Happy first Sunday of the month, and happy Sunday as well.
Yeah,
I don't
happy
really
new
talk happy
month.
first Sunday.
Yeah, happy new month. Natural, but don't forget, oh. Yeah. Welcome, specially. So today's session, na question and answer. We're ready to take as much question as we can. May we respond very fast. But I want make you know something. So I did live on TikTok. People wait there for TikTok, they hear us. Make we just see whether they go fit benefit one or two. You understand? Before we know they do the live. TikTok na very funny place. It dey frustrate my life. So I see. Now there is no question, Dr. Israel. Very funny. So let me start with this one. This question, it dey come up every time, and I think it's the best time to talk about it before more comments come in. The question now on hepatitis B. I see a lot of people, a lot. Doctor, I get hepatitis B. Abeg, wetin I fit drink? I get hepatitis B. Can I get married? I get hepatitis B. My own don finish. So many comments. So I just want make we just put one or two quick before we start taking their questions online. Dr. Israel, sharparly.
Okay. You get hepatitis B does not stop anything about you. You don't need to worry yourself too much. Yeah, we know say hepatitis B is one of the chronic disease in the hepatitis family. It's one of the one wey dey cause chronic disease, and most of the time e go fit stay person body for a very long time. And in short, most of it we know say there is no real cure for hepatitis B. Though there are medication wey person fit take, and if you take this medication, e go get to that extent wey we dey call remission, wey be say even the antibody for hepatitis B no go dey. Na be na be say if dem check am, hepatitis B go dey show, dey fit dey even dey show negative for the person body. Yeah, that is it. But it doesn't mean say the person no be positive, but e only mean say this person don gain remission. When e gain remission, e just be like cancer. When person get cancer, get where e go don treat am reach say e don gain remission. That is, the cancer don comot. So this one, hepatitis B don comot, but the person just only need to dey careful because e may, but of course other things for the for body. So that person just need to be careful. Now if person think say e get hepatitis B, e need to go hospital, e need to see a doctor. Mostly those wey dey manage that kind of thing, we dey call it gastroenterologist. You need to see your doctor and they will tell you all that things wey you need to do. Now hepatitis B fit dey acute phase, e fit dey the chronic phase. So if e dey the acute phase, that's when e dey cause a lot of problem. When e dey the chronic phase, as at that time e just dey relax. So most of the time in the chronic phase, e fit not cause any problem for the person body again. Yeah, if you come test yourself and you come see say you be hepatitis B negative, e better make you go take vaccine. There's a vaccine for hepatitis B. So when you take the vaccine, it's just a 3 dose vaccine. The first dose, 4 weeks later you take the second dose, then 6 months later you take the last dose. When you take that dose, you are immunized for hepatitis B. So if you be positive or if you be negative and your partner na positive, wetin you need to do is for you to take that vaccine. Once you take the vaccine, you no go fit come down to become positive again. And you go also fit give birth even though you be positive. When you give birth to your pikin, wetin your pikin just need to do na to dey get the drug wey we dey call immunoglobulin, wey dem dey give pikin wey dey exposed to hepatitis B. So you just give that pikin that medication as within 72 hours. After you give that pikin that medication with other things wey you need to do for that pikin, it is also very good that you give that pikin the vaccine as well, so that the pikin no go come down with hepatitis B. Yes, hepatitis B no be something wey we dey need to take joke, but with all this information wey we get for ground, I believe say yeah, hepatitis B no be also something wey we go dey fear say we no go come fit do anything for ourselves.
Yeah, thank you so much, Dr. Israel. If you just dey come, you dey welcome. Tonight we dey take questions and try to provide few answers. You understand? I beg you. I am saying this emphatically. If you have any medical condition going on, we not go treat you here. You understand? You go need to enter hospital. I beg. So that may you no talk say we no one answer you. You have to see your doctor. Now for hepatitis B, you don't hear it is not a death sentence. If you haven't gotten vaccinated, go get tested, get vaccinated, and you are good to go. Get tested and get vaccinated. No sit down. And if you get positive, you are positive. No need to panic. Speak with your doctor. And they go help you. So we dey live on Facebook, YouTube, and TikTok. If you dey watch me, share this video so that more people can benefit. I'm looking for another question here, and I want to be very fast. Okay, this person says, Doctor, please, can you throw more light on osteoporosis, the causes and remedies? So, because this is not a full lecture, osteoporosis, go just tell you briefly. Na problem of the bone. Maybe say the bone go lose in density. If the bone be like this, it's sick. Small, small, the bone go dey lose in density, wetin dey make am strong. Small, small, the bone fit dey weak, and the person fit fall down, the bone fit break, e fit fracture. E dey common for elderly people, most times for women wey don enter menopause dey go. We dey see am there. Many things dey cause am. Age, deficiency of vitamins, vitamin D, calcium, and other stuff. These are the few things to know. So if you get osteoporosis, you no need to panic. They will give you your medication. You go take your medication. The medicine go help you with your bone. You go what you call bone mineralization. Go try to make the bone strong, make it no fall, make it no break. And then for women wey don enter that menopause stage, they go give them some hormones to also try help them make dem dey fine. Okay. Let's see. Let me take one question on TikTok, Dr. Israel, and then we come back. This person says, please, oh no, do video on high and low ferritin level. No, no, I can't do video on that. That is not for social media. That is not for social media. That is for medicine. Nobody go watch that video, my guy. I'm sorry. People love video on Yash, Bobby, and the other stuff, but love everything. Nobody go watch them. Now let me and you go there and it go affect the page. So let's take another comment, another question, Dr. Israel. Okay. This question says, Doctor, what is the meaning of degenerated fibroid? We'll just talk this one, then we go to the next question. Dr. Israel.
Okay, when they say degenerative, okay, and I'm not sure say you need to dey worry about the big name when your doctor call am, or I just know say you get fibroid. So when we say degenerated fibroid, we dey talk say the fibroid don dey break down small small, but e no mean say the fibroid dey go. E don dey change e form. E don dey change e form. Wey say e first dey white, e don dey change from white to red. E don come dey, e go be like wetin e come dey shrink. As I said, e dey change e form. So that degeneration fibroid just mean say this fibroid wey e big before, e don dey small, e don dey shrink, e don dey change e form. And in some cases, e dey very painful when that thing dey happen. But as I will also say, you don't really need to bother about the name or all those big big name. You mean say wetin e still mean say you get fibroid, and you do the right thing wey you suppose do. If your doctor say remove the fibroid, say e don big reach wetin dem remove, go and remove it. If e dey cause you problem, say e dey make you dey lose blood well well, and e dey make you dey feel like say you wan faint and all that, please go and remove it. That's the most important thing. That's the most important thing. And yes, I know say the next question wey you go ask na, drug no dey when you just take drink, you just flush the fibroid comot as e don dey degenerate or e don dey do like that. Actually, e no mean say medication no dey when you go fit take. E no mean say the medication go flush the fibroid. Yeah, the medication no dey flush the fibroid. Wetin most of the time we dey even dey allow this medication for elderly people, those wey don almost enter their menopause and all that. Because why? The hormone wey dey make this fibroid dey grow na the same hormone wey dey make women get belle, and go fit take carry get belle on time. So if you come go give them that medication to stop the fibroid from growing, you also dey stop them from become pregnant. And most of these women, you say they actually need baby. So the best solution to it na to remove the fibroid so that make dem fit quick get baby. That is if the fibroid dey hinder a lot of things in terms of pregnancy. But if e no dey hinder, no problem, e can come.
Yeah, thank you so much, Dr. Israel. If you are just coming, you're welcome. Share this live session. Share. And if you are watching us on TikTok, don't forget to share. Share. Okay. Let's take this question quickly. The next question is from Facebook. I dey positive with hepatitis. My people come dey say I should not chop beans, groundnut oil. I should stop eating meat, 70% protein, wey I suppose dey eat. Please help me. Dr. Israel, let's respond very quickly, abeg.
Okay, and yeah, most of the time when people go tell you a lot of things wey you no go need to do, and it not be their fault, it's because they are afraid. Once somebody get hepatitis B, it means say e get infection of the liver. And these things wey you mention, they believe say the liver na dey work well well for those things, and e go affect you, quick make your liver die. Unfortunately, liver na dey work for everything, whether you eat meat, you no eat meat, whether you eat groundnut or you not eat groundnut, whether you eat which other thing, beans or not. Liver na dey work for everything, both medication wey you dey take. And so I think what they should have told you is that whatever you are taking, you take it in moderation. Whether your meat, your beans, your groundnuts, everything, take it in moderation. That's the most important. That's the most important thing. And I'm not telling you to stop anything. Just take everything you take in moderation. But the good thing is go to the hospital. Go to the hospital so that you can get you can get a doctor's prescription for your hepatitis B. And you'll be surprised say this hepatitis B dey chronic stage. Remember I say when you dey chronic stage, you no dey do anything, no dey do anything, you just dey there. You just dey there, full down, dey look you. So just to make sure say you no get liver cirrhosis and all that, all the complications wey fit follow hepatitis B, e go make sense say you go see your doctor so that they go put you on medication, on routine plan, on activities wey you need to dey do, wey go help you reduce any effect wey this hepatitis B don get for you or on you, or when e suppose get for on you. So that's what I can say. So I not say make you reduce make you stop all those things when you dey eat. You can eat your food. But the only thing wey I go tell you make you stop, if you dey drink, stop am. If you dey smoke, stop am.
Yeah, thank you so much, Dr. Israel. We have a lot of people watching us tonight on Facebook, on YouTube. But the funny thing is that they're not they like and they're not they share, but they won't ask questions. So what thing they shock me most times for our people be say, you want to ask somebody, may he respond to you, may he answer you, but you say you no one like, you no one share, nothing, nothing. Ah, what would you do be that? Ah, wow. Okay, so let's go to TikTok and let's see if we can take one question from TikTok. Let me see. If you know they follow me, I'm sorry, no response. I know the answer who know they follow us. Let's go very fast. Okay, so let's go back to Facebook and YouTube. Let's see. Good evening. Let me see. Okay, so this person says on YouTube, I went to do test and they said my blood pressure is a bit low. And when I ask what I can take, they said I should take enough water only. Doctor, please, I want to know if taking enough water can help truly. Okay, so number one is that you said you went to do tests. You didn't say you went to see a doctor. You didn't tell us the test you went for and why you went for the test and who sent you for the tests. You understand? And we always say something that whether your blood pressure is low or high, whatever, it's important a doctor review because some people their blood pressure fit dey low, now still normal for them. Not be everybody wey the BP go dey low, we go dey panic, especially without symptoms. So if they look you and they say you don't have a problem, just take water, fine. But if true true something dey make your blood pressure go down, water no go correct am. You have to be sure that there is no problem around. You need to correct the thing wey dey make am go down. But if your BP is fine, then still you drink your water and you are good to go. But most importantly, lis ten carefully. No just wake up and say my blood pressure dey low, wetin I go drink? Who dey make the diagnosis for you? Because some people go get low blood pressure and they are very, very fine, no problem. But everybody like to dey panic, my BP low, my BP low, wetin I go drink? It's not every time you go drink something, unless something dey wey take your BP go down and e go even dey give you symptoms. Symptoms like headache, symptoms like dizziness, you wan fall, you dey weak. These are some of the symptoms. So you can't just say my BP low, I wan drink medicine. We no dey do am like that. Shey you get the point? So Israel, anything to add quickly? We have a lot of questions tonight.
No, no,
Okay,
no,
let's
no,
go to
no.
the
Let's
let's
go.
go to the next question. I hope they ask this question. Hope say, doctor, please, what is hemoptysis? This one now, wetin you fit check for Google now. Google don give you answer. Oh baby, swear say you never ask Google. So you are not actually asking us this. I know there is something you want to ask us. So if you just type hemoptysis for Google, Google go tell you wetin e mean. Say now when you do wetin, when you cough out blood. ChatGPT go don even tell you, because a lot of people now, before they come to the hospital, they don collect treatment from ChatGPT. So that is what it means. No need to panic. Okay. Let's see. Okay, so this question says, can someone have negative H. pylori and also have ulcer? Dr. Israel, abeg.
Okay, yes, somebody can have negative H. pylori and still get ulcer because not be only H. pylori they give ulcer. Yeah, so
Mm,
there are so many things wey fit cause ulcer. So yeah, H. pylori, that is the bacteria wey fit join, wey dey more common when we talk about ulcer. But other things dey. Sometimes medication wey we dey take fit cause ulcer. And when we dey take a lot of painkillers, you go chemist, you go roadside people wey dey sell drug, all those Hausa people wey dey sell medication for roadside. You go tell dem say body dey pain you, dem count different type of medication give you. Every time you dey go take am, you fit give yourself ulcer. Stress fit give person ulcer.
mm.
Stress fit give person ulcer. So there are so many things wey fit give. I just mention only those two. Make we leave H. pylori first. Yes, I will talk H. pylori can, but when there's negative H. pylori, other things dey. Stress, um um medications wey you dey take, and so many, even our lifestyle. Some of our lifestyle fit still give us ulcer. So you just know say yes, it's possible. So the treatment na to take your normal medication, and the treatment na to, when you don go hospital, your doctor don tell you wetin you go take. You go need to take am as e take tell you, and make sure say you take am very well.
Okay, Dr. Israel. So may we take one question from one of my follower for TikTok. Her name na KK Love, and she says, by the way, these people for TikTok, they know they share, they know they like, they know they gifts, nothing. He says, please, sir, can medication boost low eggs? Can medication boost low egg? Abeg, may we respond to her.
Okay, egg for women. Yeah. Okay, when you say medication, yeah, there are some medication you take. E no be say dey, how I take put am now, e dey make you produce more eggs. Yeah, e dey make you produce more eggs, and you can make the eggs dey, yeah, and you can make the egg, those medication can just help your immune system, your hormonal system, your vitamins that the egg need to take dey very well. So when you take all those medications, some medication, not all, and that is where folic acid come to play. That's where your normal multivitamins come to play. When you take all those medications, those are prenatal medication. What they help to do is to boost your egg, to prepare the egg very well. So there are medication that can prepare the eggs, and there are medication that can make those eggs produce many, and that is make the egg come out well well. Mostly for people wey never get belle, one of the medication wey dem dey give dem na to make sure say that their egg come out well well. So when they give dem that medication, is to come out, then the multivitamin wey dem give dem is to help the egg, to prepare the egg, to make sure say the egg get, will I say get sense, to make the egg dey lively, to make the egg get a lot of things that e need to take to carry out a function.
Okay, so Dr. Israel, sorry, before we be dey talk, my own network for here the break. These people for here, I don't think that they hear. The network was quite very bad. You understand? So, but waiting this person they talk right now, he say then tell and say her egg dey low, and she want to boost the egg. She want to boost the quality of her egg. So listen, the best advice we will give to you here is go and see your gynecologist. If your gynae tell you say may you take this because you need to boost your egg, your gynae tell you take am. But the problem with most young ladies or some women is that anybody go just wake up tell dem say dem get low egg, and dem dey find wetin to take boost the egg, whereas most times dem no get problem with the low egg. Either dem dey one group, na for the group person tell dem say dem get low egg, or dem go lab but then not see a gynecologist. So the advice we will give you here, before you take anything to your system, make sure you see a gynecologist, a doctor that specializes in the management of women in that area. See am, e go give you the, e go tell you wetin to take if you need to take am o. But this whole idea of somebody tell you say is low, go and buy this, you go spoil your ovaries and e go give you problem. You dey hear me so? Okay, let's take this question from Facebook and then we take a short break. Dr. Israel. So this question says, Doctor, is there a problem if someone doesn't take sugar at all? Is there a problem if someone doesn't take sugar at all? Oh yeah.
Okay, my question to that person is, what kind of sugar are you talking about?
Mm,
That's my question to that person. Because even the food you eat contains sugar. Your
mm,
carbohydrate, they are sugar.
mm,
So what kind of sugar are you talking about? If it's refined sugar, like the sugar wey you dey put for pap, the sugar wey you dey put for tea when you wan drink am, if na that one you dey talk, there is no problem. Whether you take am or you no take am, it doesn't mean anything. But you should remember say if you dey drink coke, you dey even all those beverages wey you dey take, if you dey drink alcohol, most of all these things also contain all those refined sugar. So make you no think say you no dey take them already. Yeah. So na just that you no carry them for your eye, see am, come put am. That's the only one when you dey talk. So if you no dey take all sugar, there's no problem. Your normal food contain the normal sugar when the body need. So you have no issue.
thank you for
But
that.
as I said, which sugar you dey talk about?
Thank you so much for that question. Sorry for that answer. Okay, now before we continue, number one, if you know say you never share, click on the share button. Then for anybody we want join my private community, you want to subscribe to join my private Telegram. Look for the link on the page. Subscribe and join. Somebody they send message private, so for Telegram you won't join, you no wan subscribe, I'm sorry, abeg no vex, you cannot find the link unless you subscribe. And when you subscribe, there are many benefits for you. So if you dey watch me on TikTok, on YouTube, on Facebook, I have a private community. The link is on the page. You subscribe, you pay little token to join, and you no go regret. Okay, so let's go back and take these questions from Bella. Dr. Israel. Bella says, good evening, doctor. I love what you two are doing. We love you too for asking. Please, if one takes alcohol and smokes every day, will drinking enough water, exercise, fruits, and vegetable prevent the person from developing health issues?
This person dey drink alcohol, e dey smoke every
Every
day.
day.
Now he does exercise, he drinks a lot of water, he eats a lot of fruit and all that. If it will prevent anything, yeah. Yes, those fruits, everything wey dey eat go help the person in one way. E go help the person build the immune system, e go help the person get enough blood and all that. However, e no go prevent other things when the smoking and the alcohol fit cause.
Hmm.
You dey understand? So all those things, when because those two things, they get a lot of carcinogens, things wey fit cause cancer, and which all those your vegetable and all those things wey you dey eat may not be able to protect you against. So that's
Hmm.
why we advise say it is better not to even drink. If you must drink, I dey always talk am. I know say normally there is a study is out that say don't drink. Drinking is bad, and recently, drinking, any form of drinking can cause a health problem to you. Yeah, but it depends on the health problem. Will come depends on how you take drink. So if this person dey drink all the time. Make you all know say e don dey prepare himself for cancers, either cancer of the stomach, colon, rectum, cancer of the mouth, prostate cancer and otherwise. And so e go better make dis person just focus on his exercise, dey drink water, dey eat fruits and vegetable, and save himself, because all those one go help am. Only those things, you know how many things dey dis life when only those things wey you talk wan fight, you come still put alcohol and smoking join am by your own self. Why not stop what you can stop and focus on what you cannot stop on your own?
Yeah, why not just forget about alcohol and smoking and just focus on the fruits, exercise, and water? Yes, you cannot cheat nature. Okay, let's see. Let's see. We are live on Facebook. We are live on YouTube. We are also live on TikTok. I just decided to be live on TikTok. Not be say one thing, huh? Okay, let's take one comment from Facebook. This person on Facebook says, Doctor, what will make somebody getting lean? That is, you are losing weight, but the person don't have any sickness, but only going down. Ugo Harris. So my question to you is, how do you know the person does not have any sickness? Because you can't be losing weight like that. There's what we call unintentional weight loss, unexplained weight loss. You don't know why you did lose weight, but something they make you lose weight. For the fact that you don't have any symptom does not mean you are okay, but you are going down. Or maybe you know they chop well, or you dey deliberately do some things wey fit make you lose weight. But if you know that you are not making plans to lose weight, you dey chop, despite all this stuff, you still dey lose weight, and you no get any symptom, does not mean you are fine. Sometimes something fit dey inside your body wey dey make you dey lose the weight small small. You no go know. By the time you go realize, water don pass garri. And this is why we dey tell people, pay attention to your body. The moment you notice say your body no be like how e suppose to dey, e don change, speak with your doctor. E go examine you, e go check you, and if you need to do test, e go tell you. But just sitting down and say everything dey okay, does not have any sickness, something is wrong somewhere that we need to find. And there are many things that can cause it, many things. Malnutrition, hormonal issue, malignancy, metabolic disorders, and so many other stuff. But how you go take know, because you are not a medical doctor? This is why you have to make time and make plans quickly. See your doctor, make e check you. Huh? Okay. Dr. Israel, let's take one comment from this person on TikTok. By the way, the TikTok audience na very funny audience. They are not dey sabi send any gifts. Let's see. It says, Doctor, please, how can I stop constant headache? And we will just take the question from this person. How can I stop constant headache?
Okay, the way you fit take stop constant headache is, first of all, knowing wetin dey cause the headache. Because once you know wetin
Hmm.
dey cause the headache, you remove that thing wey dey cause the headache, the constant headache just stop. So one of the things wey fit cause headache na stress. So if you know that you are very stressed, you need to take care of yourself. Another thing
Hmm.
wey fit cause headache na, some people when they get issue with their eyes, e fit dey cause headache for them, and they go think say na just the head, na only headache dem get, not knowing say they get issue with their eyes. So that kind of person need to treat themselves, treat their eyes, and the headache is gone. You fit get other sickness, you fit get space occupying lesion for the brain wey dey make you dey get this headache. E fit be hypertension na im dey cause am. And so many things. E fit be say na because you no sleep, you no dey sleep well for night again. So if you know all these things, and then because there are different type of headache as well. So if you don know all these things, don find out say, oh, wetin really dey cause my headache, and you stop those things, the headache go stop. Some people that dehydration dey even cause headache. Say you no dey drink water very well. Some people fit get headache from there. So these are things. Don't drink a lot of water. Try to sleep very well. If the headache no come go from that, then you go need to go see your doctor. So that they can fit carry out some other investigation, do other ask you so many other questions. Try to find out wetin dey really dey cause the headache, and then they go give you the best treatment that will stop the headache for forever.
Yeah, thank you so much for that answer. I believe you heard what Dr. Israel said. Okay, let's go back, see if we can take some comments here. Okay, I dey check, I dey check, I dey check, I dey check. This person from Facebook says, "Good evening, doctor. What are the causes of waist pain? Wetin dey make waist dey pain somebody?"
Okay, and as you see take talk for headache, so many things fit still cause waist pain. And one of the thing wey go fit cause waist pain na your sitting position. So the way wey you take dey sit down fit make you get waist pain. If you no dey sit down sit straight for chair, maybe you dey sit down relax one kind for your sitting chair, you fit get waist pain. The kind of work wey you dey do fit also cause waist pain. If you dey stand for a very long time, or you dey sit down for a very long time, dem fit give you waist pain. Sometimes if person get some kind of urinary tract infection, STI and all that, the person fit still come down with waist pain. Sometimes trauma to the waist, you injure the waist, you fall, you come hit the waist for ground, the person can get waist pain. The way wey you take dey sleep, your bed, how your bed be, your bed, the foam dey solid say when you lie down you go dey on top, or na the one wey be say if you lie down the middle go inside, so e come be like say you be like V for inside the bed. All those ones fit still cause waist pain. So when you find out all these things and know why you get the waist pain, then you go come know what to do to stop the waist pain. Sometimes you no just need, no be everything you take medication take medication. You fit even take medication for the waist pain, e go, but if you continue that your previous activities, the waist pain go remain there. Why some
Yeah.
people when born with why some ladies when born with CS, when be say they give them one injection for the waist, or anybody wey don do surgery when they give injection for back, for the low back, some of them still dey come down with all those kind of waist pain because of that surgery, that injection when they give them. So there are so many things wey you can do to actually stop that. And what is it? Is to see your doctor, and your doctor go tell you.
Yeah, thank you so much for that, Dr. Israel. You know they share. I dey watch. I just check right now for Facebook. I also check for YouTube. They're not dey share. But the funny thing be say you wan ask, you want doctor answer me now. You never answer me. My turn. But you never share. Oh. Continue. No, no worry. I dey check all of una. I dey time you. I dey time you. Now let's take this question from Rosemary, and then we'll go on a short break again. Uh-huh. Let's take Rosemary say, "Hello, doctor. Is ulcer patient medication for life? Or is life? Okay. Ulcer patient medication that is for life. Are you gonna take the medication for ulcer for life? Meaning say if you get peptic ulcer disease, you go dey drink am dey go. Now make I answer abeg. Number one, a lot of people right now don dey talk say dem get ulcer, and when you ask dem who told you you have ulcer, dem go say, and dem tell me say who tell you? Number one na your neighbor, number two na one group for WhatsApp or one group for Facebook, or you just go lab, dem just go check you for H pylori, next thing na ulcer, and you didn't consult a doctor. So you have to be sure true true if na ulcer you get, because there are many other conditions that can give you the symptom that looks like ulcer. Oh, many. Now, having said that, if you get peptic ulcer disease and you follow the advice, Dr. Israel mentioned something in the beginning of this program. If you avoid abuse of certain medication, if you take the medication wey your doctor give you, if you avoid certain lifestyles, stress, alcohol, smoking and many things, your ulcer go heal, because ulcer na wound for inside your colon, your stomach, or the first part of your intestine. So if you follow all the advice, e go heal. But the problem be say some people, they go start, they go stop, they go start, they go stop. So the wound go dey come, go dey come, go dey come. So the medication is not for life, because true true dem fit cure am. But if you no follow all the advice wey dem give you, na there problem go dey, and you go drink medicine for a very very long time. Dr. Israel, do you have anything to say quickly?
No.
Okay, let's see if this person dey follow us. So let's go back to TikTok and take one question. Then we go on the break. He says, "Sir, I had miscarriage in January and I haven't gotten pregnant since then. Is there a cause?" So Michelle is asking us this question on TikTok.
Okay, when you get the miscarriage, did you go to the hospital to do a scan to confirm if everything had left and to see if that place dey free to become pregnant again? Dat na one. Two, hope your menstruation come dey normal, and you know your ovulation period, your ovulation time, and you dey meet during that ovulation time, because if you no dey meet during that time, sorry o, you may not you may not get pregnant. And the last one na be say, hope you remember say pregnancy no be only the woman dey make belle dey come. Pregnancy dey happen if a man wey e things dey very well meet a woman wey e things also dey very well, na pikin dey come. So your husband or your partner don test himself whether im own part, im own side dey very good. And lastly, as at dis time, you should be you suppose get a gynecologist wey you dey follow talk, wey dey carry you pass through the process of becoming pregnant. So if you do all these things, you answer all those questions within yourself, and you are able to do all these other things, I believe you become pregnant. So make sure you have a gynecologist with you, and I think that's the final thing I will say on that.
Thank you so much, Dr. Israel. Your response was loud and very clear. Okay, let's see if we have a comment here. Let me see. Let's see. Okay, I'm trying to check. I'm trying to check for more questions. Okay, before we continue, once again, let me talk about my course. I have a course for content creators, especially those where they follow me. I beg you, if you know say you dey post on the internet and you don't know anything about social media, about content creation, get my course. I'm not afraid or ashamed saying this. It will help you so that you don't suffer. You won't build your page and one day you lose your page. Get my course. Whether you are watching me on TikTok, you're watching me on YouTube or Facebook, the course is very cheap. It is 10,000 naira. It's a video course. So you buy it anywhere you are in the world, watch it. It will help your life so that you don't suffer. Social media is unforgiving. You go suffer if you don't get information. No. So get it and you will never regret. Check the link on my page. Get it. So that is the break. That is the advert for this time. So let's continue again our question and answer. Let's continue. Dr. Israel, we have a lot of questions tonight and we are almost out of time. This person is saying, let's see. Oh my God. He says, Doctor, what makes someone to see her period two times in a month? Why would a young lady see her period twice in a month? Now, for some ladies, it's very normal. It's very, very normal. Especially if you have a short menstrual cycle, 21 days, 22 days, 23 days. You can see your period twice in a month and it's fine. But the problem is that most ladies think that your period must be once in a month. So if you have a short menstrual cycle, your menstrual cycle dey short, you go see your period two times in a month and e dey fine. But the question is, do you even know the length of your menstrual cycle? Because if you know, you no need to dey panic. But e get some people normally your menstrual cycle na 30 or those kind of things. Now you don come change, come dey very short. Some kind things dey wey we need to find out. But normally e dey okay for some women to see their period two times in a month, and e dey very 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 fine. Ehen. Okay, Dr. Israel, you wan talk anything? Okay,
No,
Dr. Israel. Okay, so I dey check more questions. Hey, my guy, DJ X5, one of our very, very, very wonderful fan. Okay, this comment here, Dr. Israel, he says, "Good evening, doctors. I have a sister that have thyroid disease. The swelling is increasing in size. What can she use to stop the swelling?"
it's not about what can she use to stop the swelling. The thing is, now your sister should go to the hospital. You get to the hospital, if that swelling should be removed, and that's important thing to do for that your sister. It should be removed, but before they will remove it, they will want to do some investigation for your sister. Those investigation will tell if it's the right time to remove it or if it's not the right time to remove it. Because even when the swelling is there, sometimes they may not want to remove it if it's not the right time to remove it.
Yeah,
And so,
yeah.
for me, I don't think there's one thing you need to do to reduce or stop the swelling. Yes, they may give some medication that will just to help to reduce the rate wey e take dey swell. Eh?
Mm.
Rate wey e take dey swell. But only what is the better thing to do is to make sure say e go do those investigations, those thyroid function tests, all those tests to see how the thyroid gland, how the thyroid hormone been and all that. When e don fit know all those things, then the other solution, the good solution, is to go and remove it. Then e should be fine. There's nothing bad in removing it.
Yeah, there's nothing bad. You heard Dr. Israel. This person is asking on TikTok, you, Michelle, okay, can I take pregnant care conception? Sure, you can take pregnant care, but I hope all the advice that Dr. Israel gave to you, you you heard them and you abide by them. Pregnant care conception is okay, you can take as long as you are planning to get pregnant very soon. Yes, it's advisable for you to start taking those supplements. Very important. But the most important thing is to ensure that it doesn't repeat itself and your partner also sees a doctor for checkup. Okay, we are trying to move very fast. Let's see. We're trying to move very fast because of time. We're almost out of time here. Share the live session. Share, 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 share. Let's see, let's see, let's see. I dey check. Oh, doctor, where I dey understand is teaching well, well. Okay, you understand about teaching. Thank you. Uche, good evening. We greet you specially. Okay, now let's say this. For those wey just dey see this program for the first time, listen carefully. This program is every Sunday by 8 p.m. to 9 p.m. This program has been running since 2020, every Sunday since 2020. Myself and Dr. Israel here. So we are not babies in the medical profession. We are not babies in talking online. So when we are talking, we know why we tell you to do this and why you have to speak with your doctor. We are saying this so that you understand. We not they give medicine online. We know they make diagnosis here. So if you have any challenge, we go always beg you, speak with your doctor. Here is to advise you. But if you want to book a private consultation, you can do that one. But here, we will not treat you. Is that okay? Thank you very much. Okay. Let's see. Let's try to be very fast. Dr. Israel. Okay. I'm checking TikTok. I'm checking TikTok. I'm checking TikTok. Let's try to be very fast because of time. Okay. Let's see. This person says okay. This person says this one no dey matter today, but I just wan ask the pain wey woman dey feel when e menstruate, wetin dey cause am, especially from the chest side? Sometimes e go make am dey vomit. Okay, when woman dey menstruate, wetin dey make her dey feel pain, and the pain dey come from her chest, e go make her dey vomit. Okay, may I allow Dr. Israel respond?
Okay, there are different symptoms when they follow menstruation. That na woman things, eh? And most of those things now the hormone system now they cause am. So once there's a change in the hormone, and then the woman body go change. So sometimes now because the hormone change, now they cause those vomiting. Now for the pain, mostly the pain for the waist, now because of the contraction of the uterus. You know, say because things don dey the uterus, and the uterus na one place wey dey always like to dey clean, dey like to dey free,
Mm.
except when baby don enter, when you come be say you go wan stay, you go leave that baby to stay for 9 months before you go tell the baby say okay come pack your things comot. But apart from that, every other thing wey go enter the uterus find a way to remove it. And the only way wey e take dey remove am na to dey squeeze himself, dey squeeze himself. Na wetin we dey call that, we dey call am say e dey contract. So e go dey squeeze himself. The process of squeezing himself na dey cause pain for most lady. Yes, I know say you go fit talk say some lady dey no dey know, e mean say that thing no dey, e still dey happen to dem, and the uterus still dey squeeze itself. E just that those people get good pain threshold, so sometimes they may not even they may not feel it, they may not even feel it. So the hormonal changes of that woman and the contraction of the uterus na dey cause some women to vomit, some women to have that pain, some women have a lot of things, some go dey sick, some go dey stool. Everything na just the hormonal change of that woman during that process, during that period.
Okay, thank you, Dr. Israel. Let's take this question from Cynthia. Good evening, doctors. Please, I normally feel constant headache whenever I'm menstruating.
So for Cynthia wey dey always dey feel constant headache during menstruation, I go advise say even before your menstruation, it will be very good for you to be taking blood medicine. I use that word, blood medicine, fesolate to be precise. E go dey very good for you to dey take am. And also during your menstruation, e go dey very good for you to dey drink a lot of water. Sometimes most people when they lost some amount of blood, they may start having those kind of headache and all that. And some can still be the hormone. The hormone can fit just still be the one wey dey cause the person to dey get headache. And if this person no still dey sleep very well during that period, e go still get the headache. And if this thing just become constant thing, na be say anytime when you dey see your menses, na you dey always dey get this headache, you know say man, that na one of the sign for you. If you dey dat one of your sign of when you dey menstruate. And you know say na to dey drink a lot of water, take your your headache relieving medication, something wey fit relieve the headache, and don't worry, you'll be fine.
Yeah, thank you so much, Dr. Israel. We are almost out of time. We have less than 5 minutes and we are done. Let's take this comment here. It says, please, I want to ask a question. Sometimes, if I wear helmet, I will be having headache or something will be choking me on my head or in my brain. Then when I remove the helmet, in a minute, I will be okay again.
The question na why you dey wear helmet? Then you need to look at inside the helmet and how the helmet be. You already know the problem. The problem is the helmet. So it's for you to either change the helmet, get a better helmet, so that those problem will stop. Or what is the reason why you dey wear helmet? Because I no believe say na all helmet for this All helmet for wherever you are na go dey cause that. So you need to change the helmet, because actually na your helmet dey cause your problem, so that you'll be fine.
Okay. The last question, because of time, let's see. This person they ask question. He says, "Please, doctor," on TikTok. Let's take one question on TikTok. He says, "Please, doctor, why do we keep treating PID but still coming back even when you change your underwear?" I think so. You treat PID, it comes back even after changing your underwear.
Okay, PID, most of the time, those PID become a chronic disease, and any chronic infection, and anything that is a chronic infection takes a longer time before you can do anything for it. So if you not treat am for a long time, e no go comot. And another thing is that yes, we fit talk say you need to do this, you need to change your this, you need to remove it. But which investigation you do to even know wetin dey cause the disease? So when you need to first of all do some investigation to know wetin dey cause the disease. Then you go treat am, and I bet I make I still let you know say if na chronic something, you need to treat am for a very long time before e go comot. Dat na one thing wey you need to know. Yeah, thank you.
Yeah, thank you very much. Dr. Israel, I guess we are out of time. Okay, let me just take this one here. What is the medical treatment for high blood pressure? Medical treatment for high blood pressure is a very big area. You can use lifestyle modification. Lifestyle, that is, you get things where you go change exercise, food you eat. It can help you depending on the level of your blood pressure. And then sometimes you can also take medication. So it depends on many stuff. So the treatment for high blood pressure is tied to number one, waiting be the value of your blood pressure, how high it be. You go try lifestyle. Lifestyle can help you. Or if e no work and the BP they go up, the blood pressure they continue to go high, then we go give you medicine. There are different types of medication for high blood pressure. There are different types. The medication wey they go give you, when they give you, they go tell you, monitor your body. If you get any side effects, you go back to let your doctor know. And if you dey take medicine for high blood pressure, you no go stop am on your own. You can't even stop it on your own. You have to also discuss with your doctor. No be say you go start today and then you disappear, you don stop. The BP can go up. And if you dey wait for your high blood pressure to start to dey give you sign, you want make e give you sign before you know say you go take medicine, problem don dey enter your body. You are not even supposed to wait to dey get sign say your blood pressure don high. So there are different ways we dey treat blood pressure. One, non-pharmacological, and the other one na based on pharmacology, medicine, and your doctor go explain am for you. Dr. Israel, are you there? Somebody dey ask me, um causes of low blood pressure. We don't talk about the video dey YouTube. So Dr. Israel, let's round up. We are out of time. So let's round up, your final words.
Okay, thank you so much. Sorry for that little break that I disappeared small, go and do some things. So and I want to use this medium to say a very big thank you to everybody when they follow us. All the questions we wanna ask, the ones who we fit answer, and the ones where you think say we no answer and where the way you when you want am, please go see your doctor. Maybe your doctor will explain to you very well. And remember, say we know the treat for here, we know they give medication. All wetin we dey do now to educate you. That's why most of the time when we end our talk, we go end up by saying, see your doctor. Also, Dr. Fred, I want to say a very big thank you. When you did I would say you are the life wire to this program. Ask the doctor when we don't do for almost 5 years now. We don't do for almost 5 years now. Yeah. So thank you so much for being the life wire to this program, for making this program to still remain even against all odds. I don't think we've lost one Sunday. If we don't lost any Sunday, maybe na one or two Sundays that we don't lost, maybe because of activity that are very, 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 when I mean very very, we no go fit do anything outside that activity. We no go fit do anything because of that activities. So thank you for all those when they follow us. We say thank you. For all those wey never dey follow us, try follow us and make you for learn one or two things. There's power in knowledge. There's power in knowledge. And one thing I will let una know, e no mean say we know everything. We don't know everything. So whatever we tell you today, by tomorrow some of them fit change. So e mean say as we dey talk to you, sometimes you have the opportunity to go to online and all that. Try and check most of these informations and so that you know say oh wetin we dey tell you, wetin we dey tell you or wetin we dey teach you na true. I no go end by with that I no talk about small about some few things wey we notice say dey happen around in the land of for those wey get HIV and for every other person. So prevention of HIV now na one better thing wey we need to look into. Abeg for everybody, if you know say you still dey play one or two, please make sure say you dey prevent yourself very well. And if you no dey play one or two very good, make sure say even your partner no dey play the one or two. And for those wey don already be positive, don't worry, everything still dey go on as e suppose be. And there's still medication for every and make I also let you know say we still dey here to serve you guys better in all round, in all round. Thank you, thank you.
Thank you so much, Dr. Israel. Thank you very, very much as you dey join here in Noisy. Um, Thank you very much. This person will come here. The person just they tell people maybe they go do different tests. If you notice, we know they tell people, we they tell them make them go hospital. We know they tell people go and do this test. We are very careful on this platform. So my guy, you know yourself. You just enter the live session since you they share test to everybody. Be very careful. If you're a medical professional, calm down. Some young doctors body can they catch them. The one they share make people know so you be doctor. Calm down. That is not how medicine is done. I beg, take careful with human life on social media. And thank you for watching. Thank you for spending your data here. We will see you next Sunday. And I go always tell you, good life now waiting. Good life, good life, na sense. Take care and have a wonderful day. Bye bye.
Bye bye.